How specifically can phentermine and tirzepatide be used together? That's what we're going to talk about today. Hi, and welcome to my channel. My name is Dr. Megan. I am a board-certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually prescribe these medications all the time. I actually talk to patients about their weight all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. So if you're confused about your weight, if you have questions about weight medicine, and if you want medically based answers to your weight questions, you are in the right place. So today is a video that is based on an excellent viewer question, and that question was, can you do a video on specifically how specifically phentermine and Zepbound can be used together? So this is not medical advice. As always, consult your prescribing physician, but I'm just going to walk you through, clinically what I would be thinking about if I had a patient hypothetically who might want to be on both. So in the first situation, let's say somebody, they can't get their Zepbound approved. How many times has this happened for people? It's taking forever, and we're not sure if it's going to go through. But they're a good candidate for oral medications. And I've made a lot of videos about phentermine and if you're a good fit for phentermine and what are the side effects of phentermine. So you can definitely check all those out. But phentermine is a great place to start for a lot of people. Not everybody, but it's a great place to start for some people if it looks like an oral medication is appropriate. And it's going to be a while, or we're not sure about the injectable situation. So in that case, a lot of times I will start with phentermine. So every physician has their own way of starting somebody on phentermine. What I like to do generally, I could start somebody right at 30 or 37.5. I kind of feel like that's, I don't love to do that because I like to keep an eye on side effects. And phentermine, the great thing about phentermine is it works really quickly. So unlike Tirzepatide, which is going to take a little while to see an effect, phentermine, you get that because it works in a different way. The appetite suppressant effects happen pretty quickly, but then so do the side effects. So basically, I usually start people on 15 milligrams. I'll start them on that. I'll keep them on that for 1 to 2 weeks and then bump them up to either the 30 or the 37.5 milligrams, and that's the highest dose. And usually I check in with them pretty regularly over that time and see how it's going. But you don't actually, phentermine also does not have that extended titration period that the GLP-1s do. So that's another nice thing about it. And then basically I'm just going to watch them and see where they end up at their new normal for phentermine. And that could take several months because even though phentermine works quickly, the weight doesn't all come off at once. So the dose is going to be pretty steady early on in the first month or so. And then we're checking in pretty regularly to see, okay, where do you get on your new normal? Usually it's around 5 to 7% total body weight. But of course, there are the people who are outliers. And I've certainly had people lose a lot of weight just on the phentermine. For some people, it works really, really well. So that's what I'm doing. I'm waiting until my patient's weight has found its new normal. Side effects are okay. Everything's looking good. And it's been there for maybe a month, maybe 2 months. Things are stable and they're feeling good. And we feel like they've found their new normal on this medication. But let's say it's not quite where we feel like it should be for health reasons. And of course, we're always working on those lifestyle changes as well. That goes without saying, but I will just state it. And then we decide, oh, guess what? In the meantime, their Tirzepatide, their Zepbound has gotten approved. So then I will just go ahead and start them. If we have a discussion, we feel like they're a good fit at the 2.5 and then titrate up slowly depending, at least every 4 doses, if not slower. But again, the nice thing about the phentermine Zepbound combo is the side effect profile is quite different. And so I don't feel like, unlike with metformin and Zepbound, where I feel like I'm kind of layering one on top of the other in terms of potential GI side effects, I don't feel like that usually with the phentermine. And so they may react very differently to the Zepbound, but I don't feel like, if they had bad GI side effects like on metformin, that I might make it worse. So it's kind of it's in a kind of different category in terms of what I'm thinking about for side effects. And so I'm just titrating up, seeing how things are going. They may have to go slower. They may be fine going up to the, up 2.5 milligrams every 4 doses or so. But the key is that really everything's settled down with the phentermine and you have a good idea of where they got to with that medication before you start the next one. So let's move on to hypothetical situation number 2. Immediately their Tirzepatide got approved. Yay, how fabulous. Let's start with that because it works so well. People can lose up to 20% of their body weight. Let's start with the Tirzepatide. And of course, I'm starting everybody out on the 2.5 milligrams, unless they're transitioning from a high dose Wegovy or something like that. So they're starting out at the 2.5, titrating up at least every 4 doses as appropriate and really monitoring their side effects. And I'm checking in with them pretty regularly along the way. And then again, I'm titrating up either to the full dose where maybe they hit their goal, probably not for the purposes of this hypothetical situation, or where they can tolerate. And I'm keeping them there for a while before I do anything else. So I know this is their new normal. This seems like where the Zepbound is going to get them. And then let's say, okay, again, not quite where we want to be health-wise for their BMI. You can go ahead and add the phentermine. And again, the nice thing about phentermine is that it works pretty quickly. Not the weight loss, but the effects work quickly. And so you don't have this extended titration schedule. So probably within about a month, I'm able to get them to the maximum dose of the phentermine, 37.5. And then it's really just watching and see how it goes and checking in with them regularly. And again, figuring out where that new normal is and seeing how they do with that. It's never a race, and it's always based on patient preference and a discussion on risks and benefits. And of course, if you're going to be on one or both of these medications, I always tell patients, really think of this as a commitment forever, because that's where we are with these weight medications right now. We don't go on them and go off of them. We go on them and we stay on them. And we do that so we're preventing other things from happening in the future. So thank you so much for that excellent question. I hope you enjoyed these hypothetical situations. Again, not personal medical advice, but just walking you through clinically what I'm thinking about if I'm combining medications for people. If you want to see more of these videos, let me know. Subscribe to my channel. It's the place for medically based answers to your weight questions. And if you want to work with me directly, if you're thinking, should I do this on my own? Should I try one of these medications? We can definitely talk and I can help you with that. I'll leave all the info down below. Thank you so much for watching and please be well.